Welcome to Gun Safety as a Public Health Issue, presented by the League of Women Voters of Bucks County and featuring the work of members of the League of Women Voters of Greater Pittsburgh. My name is Kathy Beveridge, and it is my pleasure to be your Zoom host this evening. This presentation is in webinar format. Participants other than myself and our presenters are not visible or audible. We will use the chat box to share information and links with you that relate to the content being presented. If you want to ask a question, please use the Q&A feature. You should be able to see it at the bottom of the window where you see me talking. Captions are available to each participant if you'd like to turn them on. This program will be recorded and available on our YouTube channel should you want to review it or share it with others. The League of Women Voters is a century-old organization dedicated to encouraging informed and active participation in government. We are nonpartisan and never support or oppose candidates or parties, but we do study issues of importance to voters and we take positions on those issues. The League of Women Voters of the United States currently holds positions on violence prevention, adopted in 1994, and gun policy, adopted in 1990 and amended in 94 and 98. The League of Women Voters of Greater Pittsburgh has since adopted a gun safety position that is broader in scope than the current League position, endorsing a public health approach to reducing gun violence. Our program this evening will share their position and the research they conducted that underpins it. Now it is my pleasure to introduce our presenters. Our two speakers this evening have been heavily involved in researching and developing the Greater Pittsburgh League's position on gun safety. They are Preston Scheimer, co-president of the Greater Pittsburgh League, and Nancy Narragon, gun safety director of the Greater Pittsburgh League. Welcome, Nancy and Preston. The floor is yours.
Thank you so much, and thanks for tuning in tonight. We are here tonight to talk about guns and their place in our society, focusing on the gun safety position recently adopted by the League of Women Voters of Greater Pittsburgh and presented at the League of Women Voters National Convention in Washington, D.C. last summer. The opening statement of our position reads this way and is our motivating statement. The League of Women Voters of Greater Pittsburgh believes that existing gun laws and regulations at all levels of government do not sufficiently protect the public from the severe effects of gun violence. The resulting gun culture is destroying civic life in our country, undermining our communities, and has created a public health crisis. Some of you may believe or ask the question, with all that's going on in Washington, is it still worth studying this issue? And we want to say that it is, because we live in the most gun-intensive country in the world. Our response to this fact has been to adjust our personal lives to avoid dangerous places, such as watching TV rather than attending large events, locking doors during services at churches, and having active shooter drills in our schools. The recent events also play into this. A recent New York Times article about a new class of gun owner is titled, "They Never Planned to Buy a Gun Until Now." There's a link to that in the chat, and it's a long article. I encourage you to read it because it speaks to why this is actually a societal issue. And just today in the Philadelphia Inquirer, SEPTA, there was an article about SEPTA installing bulletproof cages around their bus drivers to save lives. And in the Surgeon General, in his 2024 report, which covered the same time period as our study, determined that our gun culture is a public health crisis. So what can we still do if we can't do anything on the federal level We can still work at the local and state levels. Lots of things are actually happening around the country dealing with gun safety. We need to build a groundswell of support to take action in the future. And we need to be ready with ideas and programs when we have new elections and things change. So why do we say this is a public health crisis? How did we get here? As a child growing up in a small town in New Jersey, I knew people had guns. My grandfather and uncles hunted occasionally, and the community norm was that everyone respected guns and stored and handled them safely. And that was what the NRA stood for at that particular time. As I walked to school in downtown with my friends, it never occurred to any of us that we might be shot. Columbine was a major shock to everyone. We thought it was a one-time event. Then others occurred, and the number and frequency escalated and expanded to sporting events, movies, grocery stores, malls, etc. The Newtown, Connecticut massacre of 26 little children and teachers left our League members scratching their heads, saying, "What is happening in our country? This is unacceptable. How big is this problem? And how can the League address this?" We attended a lot of community meetings of worried and anguished and upset citizens, but there was no real explanation of why this was happening or possible solutions that emerged. So our League response was to devise a study to try to understand what was happening and what could be done. We decided we needed more data and to find different, less contentious ways to talk about guns and their place in our society. We employed a process called deliberative democracy, and Preston will explain how it worked.
Deliberative democracy was something that was new to me at the time, and we're talking now in a time frame of about 2013. It was, as you can see on the screen, it was a process that was used in various places across the country, but in Pittsburgh, Carnegie Mellon University actually had a project team that was promoting deliberative democracy. At the time, and thanks really to Nancy Narragon, we were able to raise about $40,000 to conduct this study. And that included then the ability to have a project leader who was a assistant professor at Carnegie Mellon work with us and who helped us as the facilitator. But the concept is basically that if you bring diverse people together and have a fact-based real conversation with them, you might come up with some interesting solutions. So on the next screen, I'd like to show you the essence of what the deliberative democracy approach is. And frankly, you can take this approach. You don't have to have a facilitator and a professional staff to do this, because since we used it for our big study, others in Pittsburgh have followed the same model for smaller groups, and it really kind of works. I'm sorry the screen is so small, so be sure you order the slides so you can get the bigger version. But let me tell you how it works. It starts off with trying to get a sample population that truly represents the entire community of interest that you're working in. So the first step is actually to take a look at all of your population and then come up with frankly, an email list that represents a lot of people from all kinds of parts of the communities. And you start off by sending out an initial survey. The initial survey is designed to see how each person might fit into the broad spectrum so that you can select from that survey a broad spectrum of participants. And people, of course, have to agree in the survey that they'll participate. And so you throw in a few benefits like maybe a free lunch. But the next step is that once you've gotten your group of people who are going to participate, you then send them background information on what you're going to be studying. And of course, in our case, the facilitator helped in developing that material. And we're happy to share that, even though it's a little old, it's still really very valid if anyone is interested. The next thing that happens is you bring that group of people that you've surveyed and identified as participants into a group discussion. And these are small groups. In our case, it was typically a table of 10. And at that table, we had a volunteer facilitator. We also had a note taker, because let me tell you, the conversation comes fast and rapid as you get going. So you need that kind of a note taker to take information. And you work on questions relating to guns in this case, and the effect of guns on the community, a variety of things. The idea is to bring out solutions that people might be thinking about and they're willing to share them. But there are also questions that are going to come up. So you also have available a resource panel of people who are perhaps experts in certain areas. Policing is one area that we felt we needed to have a resource person. We had the chief of police of Wilkinsburg at one of our events. Typically, there are questions about healthcare because, of course, mental health and particularly suicide is an issue in gun safety. And we had representatives from those communities there. Those people are a resource. So at our various tables, if we had a question, we could raise them with our resource panel and they would help clarify things. After those presentations, we came back into the group and trying to finalize what we learned and decided in our roundtable discussion. And when we're all through, everybody goes home, you conduct an exit survey. Because there are some things that people will put into a survey they may not share at the table. So in any event, with that process, we were able to come up with a lot of information. We spent a lot of time analyzing it, trying to come up with really the core things that we had learned from all of those populations. One of the things that as a committee we felt we needed to do at that point was begin to define what is success. If we are able to do all the things and suggestions that we achieved through our deliberations, how would we define success? So the next slide, please, is where we show what we came up with. And while this was done several years ago now, we think it actually has validity today. We will be able to define success in managing our gun culture when it's a cultural norm. Think about other things that we've had to deal with in the past, everything from gun safety we're dealing with now to car safety in an earlier generation, viruses, fires, all kinds of hazards. But we've learned to live with them and they become part of our culture. Guns are part of our culture and everyone accepts response. A second defining success point would be when guns are part of our culture and everyone accepts responsibility for their safe use. And that is both the gun owners and the non-gun owners. In our study, we learned that really these two populations have a great deal in common, and both are part of the solution. The gun owners are responsible for their guns. Seems like a reasonable thing. Guns are only used by people who are trained to use them safely. We provide training for people who drive cars so that they use them safely. Why don't we do it for guns? Guns are used for legally defined intended purposes only. For example, the military uses guns for their intended purposes on the battlefield. People who go to target practice use guns legally to shoot at targets. It's in that environment where we would have defined success when we were using our guns in appropriate situations only. We know that guns can be built with safety features that make them harmless except for the trained users. We'll be successful when that's the way our guns are being built. And finally, gun usage doesn't result in economic costs. that the non-gun owners, as well as gun owners, must pay personally or publicly through taxes. We're going to spend a little bit of time on that later on in our presentation. But the economic cost of our current gun culture is extraordinary. And most of it is being paid for by you and I through our taxes. The next slide is where Nancy's going to talk about other findings that we found in our study.
There we go. So I wanted to share some of our significant findings and conclusions that came out of this study, and they formed the basis of our position. We still live in the most gun-intensive country in the world, and citizens are still fearful to go about their everyday activities and are adjusting their lives to fit in with this gun culture. We read about the history of guns in America. They were initially viewed as a tool to be used mainly to defend our country and for hunting and gun sports. After World War II, the gun industry faced diminishing orders until someone recommended changing the message to men actually needed personal weapons to protect their family and property. This appealed to the returning soldiers and war heroes and was also supported by the NRA. So we entered into a new era of gun culture, marking gun owners as self-reliant, independent, masculine, strong, capable, and patriotic. Also, the Second Amendment was refocused to support the individual right to carry a gun. In our study, residents in areas where many Pittsburgh shootings occurred wanted more community policing. They wanted the police to get out of their cars, walk the streets, get to know the residents and the local businesses, and be better able to determine who belongs in the neighborhood and to take note of outsiders. They also wanted more support, all types, by government, community leaders, and law enforcement for citizen-led initiatives such as Mad Dads, and for development and support for neighborhood facilities and programs to support youth, especially preschool and after-school hours. They also wanted rehabilitation of abandoned houses and empty lots because they attract the drug dealers who bring the guns into the area, and then you have your crime along with it. Responsible gun owners are supportive of requiring training for shooting a gun, but they do not want it to be mandatory, and they do not want to pay for it themselves. In order to promote real progress on the gun issue, the following two facts need to be accepted. First, that the Second Amendment gives citizens the right to own guns. Fighting this just delays any movement toward reducing gun violence, and it's unlikely that any kind of consensus on the true meaning of the Second Amendment can be achieved in the near future. Second, that the removal of guns from society and/or from individuals is not feasible. Currently, there are over 400 million guns of all kinds in the United States, and only 2,600 alcohol, tobacco, and firearms special agents, and only 330 million individuals in the United States. Most guns are owned by law-abiding collectors, hunters, and target shooters who think they are already responsible gun owners. We also learned mass shootings account for only 1% of gun deaths, but 90% of the headlines and public concern. Suicides account for 60% of gun deaths across the board and all around the world. Homicides take second place for the number of gun deaths and injuries, fueled by 50,000 guns, mostly handguns, that are smuggled across state lines annually. Each type of gun violence is different in its root causes and potential solutions. Given these facts, we determined it is essential that gun owners are active partners in the gun safety paradigm. They need to accept a collective responsibility to practice and promote responsible gun ownership and make a safe gun culture the new norm for society. It's their community too. Also, that we've learned that the current gun culture has extracted a very heavy financial penalty on all levels of society. That has been borne by all of us citizens, whether or not anybody owns a gun. For example, note the extraordinary amount of money expended annually to harden our public schools, provide security personnel, and conduct active shooter drills. Note also how much is being spent annually for security by businesses, sports and recreational facilities, and to secure other public spaces. The annual cost of gun violence to the U.S. economy is estimated at $557 billion per year. That's B with a billion. These are direct costs for shootings. These include police investigations, prison and jail costs, court costs, hospital stays, long-term mental and medical care. 87% of these costs fall on the taxpayers. It also includes indirect costs, changes to the quality of life, lost economic development, lost wages, lost work and employees to employers, security costs, schools and businesses, etc., and the underlying damage of fearfulness to our sense of community. So in response to that, our league made a video, and Preston is now going to talk about that.
Right. Sean, thinking about the time that we were talking about and working on this, these initial studies were done in roughly between 2013 and 15. I can't say that the situation has gotten better since. However, when we did not go into the league members in the audience, you'll know that a league study involves a tremendous amount of research and lots of discussions and whatever. And we kind of stopped working on this because of the political situations going on, other emphasis that the league had to deal with locally. And then we had COVID and the history. So we came back to this project about a year and a half ago. And at that point, we realized that we had a lot of new members in the Pittsburgh League, and we needed to do something that would introduce and give them the background of why the study was done, what the findings were, but also really to set the tone for why we needed to take action. So we made a video. It was done by one of our members. We actually started off with some typical warnings about what you're likely to see. And when it starts, it's just going to be a black screen. You're going to hear some sound, and then gradually it gets going. And when it's through, we'll talk about things in the current year. We've been talking about the past now. So if you'd start the video, that'd be great.
My name is Nick, and I'm going to be the next school shooter of 2018. My goal is at least 20 people with an AR-15 and a couple tracer rounds. I think I can get it done. Location is Stone Douglas in Parkland, Florida. It's going to be a big event. And when you see me on the news, you'll all know who I am. You're all going to die. Pew, 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 pew. Yeah. Can't wait.
Holy. Oh my God!
Mr. Ruth, you're charged with 9 counts of murder and 1 count of possession of a weapon during the commission of a violent crime. Before we go into the bond process, I would like to ask, are there any members, or is there a representative of any of the family that would be here that wish to make a statement before this court before I post or set the bond? You are representing the family of Ethel Lance, is that correct? And you are whom, ma'am?
The daughter.
The daughter. I'm listening, and you can talk to me.
I just want everybody to know, to you, I forgive you. You took something very precious away from me. I would never talk to her ever again. I would never be able to hold her again. But I forgive you. And have mercy on your soul. You hurt me. You hurt a lot of people. But God forgive you. And I forgive you.
In 2023, there were 43,000 gun deaths, 656 mass shootings, and 350 school shootings. Thousands were injured, and lives changed forever. Whether or not you are a gun owner, these statistics are staggering. We need our elected leaders to do more to protect our society. We have an unrestricted gun culture fueling an undercurrent of fear that is affecting the way we interact with each other. Polls show over 1/3 of people say they avoid attending certain events due to fear of gun violence, or have considered avoiding such events. Nearly half are afraid of being involved in a mass shooting. Official responses have been to fortify our schools by arming teachers, conducting active shooter drills with students, and hiring armed guards. We fortify our public buildings by adding scanners, hiring more police, and doing bag searches. These responses are inadequate and delayed. We have passed laws to help make a dent in the problem, such as red flag laws, raising the legal age to own guns, adding universal background checks, but these solutions don't go nearly far enough for this massive problem. We have heard people with the power to do something offer their thoughts and prayers, but say there's nothing they can do because the right to own a gun cannot be restricted in any way. What we are doing is not working. Gun violence and gun deaths increase annually. Guns have become the #1 cause of death for children under 18, primarily through direct assaults. We are sending our children to school as if they live in a war zone. We are normalizing school lockdowns and active shooter drills. Children don't want to go to school. Anxiety, especially among our teens, is rising at an alarming rate. Suicides by guns are increasing. The responsibility for dealing with gun issues has been transferred to the victims and their families as they pick up the pieces. Families are not only dealing with unbelievable grief, they also have to pay for funerals, medical expenses, live with lifelong injuries and disfigurement, the loss of work or income dealing with their enormous losses. They need mental health counseling. They have to deal with legal issues in the aftermath and so much more. The phenomenal cost of our unmanaged gun culture has been transferred to the taxpayers through training of teachers and first responders, hiring additional police and staff, special police training, equipment, crime scene processing, and more. Our unrestricted gun culture is undermining our sense of community. Where are we safe? It is undermining our trust in each other, in our institutions, in our police and justice system, in our elected officials, and in our Constitution. This has become a societal problem that needs a comprehensive approach to strengthen the public health of our communities. The Second Amendment and the Supreme Court say that citizens have a right to own a gun, but no right comes devoid of responsibility and accountability. We need to manage our gun culture in a way that allows the majority of non-gun owning and gun-owning citizens to enjoy their lives without fear of becoming a victim of gun violence, while also providing responsible gun owners with the freedom to enjoy their guns legally. We believe the existing League of Women Voters position is too narrow to address this issue of this scale. The League of Women Voters of Greater Pittsburgh has adopted a local position that incorporates a collaborative public health approach and can serve as a guide for dealing with this heavy issue. We encourage you to read the position and recommend to the League of Women Voters of the United States that it be adopted by consensus as an addendum to our current position and expand our ability to approach these issues as a national movement to manage our gun culture.
So the question is, why do we talk about public health? Because this is a public health crisis. We need to focus on a comprehensive policy that approaches through, we need to focus on comprehensive policy, approaches through public safety initiatives that target the health and safety of our communities, local, state, and national. I want to share with you an illustrative story told by the Surgeon General as to why he sees our gun culture as a public health crisis. He said that a grandmother had come up to him and told him that she'd taken her 6-year-old grandson to buy new shoes for school. And he said to her, "Grandma, I don't want to get any shoes with lights because they might show the bad man where I'm hiding." It's just very disturbing to think that young 6-year-olds are thinking about survival in a gun incident. But public health is a multidisciplinary by nature and can range from formal legislation to community outreach efforts. And public health policy plays a role in multiple sectors, including healthcare, insurance, education, agriculture, and business. By treating gun violence as a public health crisis, it treats firearms as we do other potentially dangerous consumer products. We can point to so many such successful programs with food safety, car seats for children, tobacco and smoking, pesticides, and drugs. A public health approach takes the issue out of the partisan political realm and puts it in the community. It puts the focus on how to live with guns, maintain a community where all people feel safe and secure from gun violence, and yet allows responsible gun owners to continue to enjoy their guns for legal purposes. Public health opens up a wide array of strategies for dealing with the effects of gun violence and for encouraging gun owners and non-gun owners to collaborate for the common good. These can include taxation, insurance, education, licensing, and health and informational outreach initiatives. The League is uniquely qualified to help communities develop such strategies that are effective and publicly supported. The position we have adopted equips the League to respond to a broad-based assortment of gun safety initiatives on multiple levels. Preston?
Actually, Nancy, I think the next slide is still yours. We're talking about the details of our position.
Nope.
This is me? Okay. The little side story. When we took the position to the national convention, we were criticized because it was too long. So we had to come back and rewrite it. So the parts we're showing you on the screen are the official position. There is, as with any leak study, background information, which is also included. So in stating our position and why we thought the public health approach was so important, we broke it down into the A to E dot points that you can see there. So that we were behind each one of those, there's more detail down in the background information. But the principal reasons for this position are that we want to use the public health approach to address the following items. Gun suicide prevention. As Nancy mentioned in her statistics, that is the highest thing that happens with gun violence. It's people taking their own lives. And as we know, from other studies, the decision to make a suicide can many times be a last minute thing. And we have learned that if there is a gun available, it's likely that last minute decision to take one's life can be facilitated and work to take the life because the gun was there. If there isn't a gun there, then frequently intervention can take place and that life can be saved. So that's one area. It's a broad field, but that's one area where we would like to use public health as an approach. The second is in the regulation of weapons that really have no legitimate civilian use. The people who are gun owners who are going to ranges usually use pistols and rifles. There are some these days that take AR-15s, but that is not a legitimate use for a weapon of war. So we need to have regulations that prevent the population from having access to guns, which are really weapons of destruction and not sport weapons or hunting weapons. The third point was to focus an area on public health that would direct towards public product safety and responsible gun use. We do this all the time in the public health environment. We certainly have lots of effort goes into be sure that drugs are used appropriately and responsibly and not just used without prescriptions and other controls. And there are many, many examples of this approach working for other things that are a part of our lives. The fourth point that is establishing financial responsibility. As Nancy mentioned, the cost of gun violence is huge. It's in the billions, as she mentioned. And at the present time, it's these things are being paid for by you and I through our taxes, and both at the local, at the county, at the state, and at the federal level, because there are costs. When somebody is shot, emergency services are brought into play. There's all of the policing, the detective work to find out the culpability, to track down the offenders. You can just imagine the host of things, if you think about it, that go on, all of which have people involved, equipment involved, and compensation has to be made. To say nothing of the physical violence to buildings and other things that can occur. But then there is also the tremendous cost to the victims, which nobody covers. It's their loss. And the fact that they've lost their ability, some lost their lives. The ones that don't lose their lives frequently have tremendous rehabilitation costs. They may have lost their careers. They may have families are put at tremendous distress. All of that has costs, which are not being borne by the gun industry or by the gun owners. And finally, there's an important role for local governments, particularly in the current political environment that we're in right now, because it seems very clear the federal government is not going to do anything, particularly in this area. But local governments and state governments are where the action is actually taking place. And we recognize in our position how important that role is. So those are the principal parts of our policy in that area. If you go to the next slide, which was should be the slide that says, "Are strong gun laws the answer?" Our focus over the years has been in the legislative area, as you know, and trying to come up with laws that would solve these particular problems. And fortunately, there's an organization which some of you know, Everytown for Gun Safety, which has been funded well enough to begin to do some important research in this area. And they recently published a report which shows the what's happening in all the states based on their gun laws. And as we scroll down through that report, you'll notice that they show states, the strength of their gun laws, and the gun violence rate. The winner happens to be California. They have the, based on their study, they have the 90.5. They're the strongest gun laws. Their composite score is 90.5, and their gun violence rate is 8%. As you know, California is a hugely populated state. It's a big geographical area. It probably has every possible problem one can have in any way in a society, but their gun laws have kept that gun violence rate down. Other states that are national leaders are listed there. What is surprising, however, and maybe good news for us, is that Pennsylvania ranks 18th. Nancy and I were pleased to see that and a little surprised. And we're going to look at a moment in some depth into Pennsylvania, but we come off with a rating of 39.5 and a near average rate of gun violence. If you scroll at the bottom of the screen and you see the states where they have weak systems and the national failures, take a look at Mississippi. That poor state has gun law strength of 4 and a violence rate almost at 30%, at the 30, among the highest in the nation. But look at the other states that are there in that category: Georgia, Arizona, Alaska, New Hampshire. It's surprising to see some of those states that are doing that way with such low laws. In case of New Hampshire, you have probably the gun violence rate is lower because it's such a hunting state. If we go to the other link, which takes us to Pennsylvania, we can look in more detail. And the value of this particular study is from my perspective, is that they have the Everytown for Gun Safety has developed 60 key policies relating to guns, and then they use to rate. And so this is the Pennsylvania ones. In some cases, it's kind of interesting how much we have done that is successful. If you look at the first category, which are the fundamental laws, we have background checks. We have a concealed carry permit. The ones in this area that we don't have are listed there: extreme risk law, no shoot first law, and secure storage. Secure storage probably represents an opportunity for us at the local level. Secure storage could be something which a local government, like a township or a borough, could require of their residents. So there's a possibility there of improvement. If we scroll down further, the gun industry and product safety, well, we're not really very good there at all. Look at all of the opportunities that could be for improvement there, like bump stocks being prohibited. The only thing we have that's going for us in this category is we require gun dealers to be licensed. There's a lot of opportunity there. We go to the next one, it's guns in the public. Well, we're better here. We already have no guns on college campuses, no guns in state capitals or at demonstrations, no guns in K-12 schools, and we have a concealed carry authority. Officials can bar people with concealed carry who are likely to have dangerous commitments. There are some opportunities there. Then if you go to the next level down, keeping guns out of in the wrong hands. This is where Pennsylvania's done a particularly good job. We already have laws against fugitives from justice prohibiting. In other words, we bar gun possession by fugitives. We have hate crime prohibitors, mental health prohibitors, minimum age to purchase, no gun after violent offenses, prohibition of domestic abusers, restraining orders, and a whole host of things here. So we are really doing a good job in this particular area of keeping guns out of the wrong hands. In policing and civil rights, the next area down, we do make a real effort for doing gun crime tracing. Now, the problem with that particular one is that it takes away police from doing other things. We learned in our study, for example, that in Pennsylvania, gun owners are not required to report when their gun is lost or stolen. But if a gun is used in a crime situation, the police get the gun, they have to identify if it was stolen, and they have to work hard to get that gun back to the owner. We could improve that if we had a requirement that when your gun is stolen, you have to report it. But coming down, the most important thing that I think we could do in Pennsylvania is the third point, which is that local law allow local laws to be allowed. Pittsburgh, as many of you may know, has tried very hard to be able to regulate guns, and it's been turned down by the courts because in Pennsylvania, only the state government can control laws, has the ability to have laws regarding guns. We'd make a lot of progress if communities were able to control the use of guns in their communities. But in other areas there, you can see some others where there might be an opportunity to develop positions and legal and laws to help in that category. And then finally, in the sales and permitting area, we do pretty well because we have this, the Charleston loophole is closed, mental health record reporting, state records sent to law enforcement, and so forth. We could do things more with waiting periods. So there's opportunities there. I wanted to point out this particular study because as we move forward in figuring out how to use our position and to work for improvement, there are many good ideas that this particular report put in our hands. So what are those next steps? Let's go to the next slide. We feel very strongly that the Surgeon General's report gives us a tremendous background of information and statistics and helping in the educational process of why guns are part of a national crisis. As I've been mentioning, we recognize that we need to use our local, in our case, for Pittsburgh, the local position to work for living safely with guns wherever we can locally. We have found already that other groups that are interested in working with the League and with other gun safety programs are using the deliberative democracy type approach in working with their churches and with their other citizen groups to educate on the issues around gun safety. And then with the position also gives us the League. As you know, as a League member, you can't speak on anything officially until you have a position. So in Pittsburgh, we couldn't speak about gun safety until we had this particular position. And so we are encouraging partnerships with other leagues and with the hope of having a national position at some point. We are working this year in bringing our local position to the state for hopefully getting it adopted by consensus. So in Pennsylvania, we would have that position to be able to work on at the state level. And then finally, I'd just like to end with going back to what will define success. Because even though we developed these in 2014, they still really are true of how, if we're successful with our position and implementing our position and working for getting our country to recognize that guns are a public health crisis and that we can solve it the way we've solved other public health crises, that we will have become successful. So I thank you very much for your participation. And I think we're going to move to the Q&A part.
Thank you, Nancy and Preston. That was tremendous. So we are waiting for people to put some questions into the Q&A for us. I'll just start out by saying how much I appreciate the work you did to reframe the way we approach this issue. And I think it creates a much better opportunity to have dialogue and to make progress on things that are very commonsensical, at least from my perspective, and that deserve to be addressed as opposed to just standing on opposite sides of a very controversial issue. Let me just get us started by asking you to say a little bit more about the local opportunity for action. What do you think that would look like in one of our counties, for example, if we were to try to push forward on some of these issues?
Okay, well, I'll take a jump at that. The one that occurs to me is that counties and municipalities across the state would like to join in supporting is getting the right to establish local gun laws for their county and their community. Because we are such a diverse state with, the concentrations of big city life in Philadelphia and Pittsburgh and then in Scranton and Harrisburg and so forth. But we're also a very agricultural rural state. But in any location, having a AR-15 shooter coming into a school is just as violent. Doesn't matter where it is. It is just as harmful. So if we had local control over and the ability to set local guns, we could begin to address and work with gun owners and gun schools and so forth to really have a program for supporting the sport of gun use and the sport of hunting. And at the same time, have laws which forbid AR-15s to be found on the street and would allow local police and other people to collect them and so forth. So it's one area where I think we could, as an organization, push that would benefit the entire state.
Okay. So we'd be working on that with our representatives in Harrisburg.
Yes.
Yeah, and it's so important really to involve the gun owners in these discussions. And one of the first things I think a local community to do be try to meet together with gun owners and try to change their focus from the question of individual ownership, which gets you into the Second Amendment stuff, and have them change their focus to trying to prepare and make local gun safety part of the local norm. And one way to focus on that is partly to deal perhaps with suicide. Since suicides are 60% of gun deaths, if we can try to bring that down, that would be a huge benefit to our communities. One of the promising things for us is what's called smart gun technology. And this is a type of technology where someone who buys a gun also buys a chip in the that can, I'm sorry about that. Chip that prevents that gun being fired by anybody except the person who bought it. That would be a fantastic help as far as suicides are concerned, because very often and the people who commit suicide do not do so with their own guns, but with just one that happens to be lying around. And in work, if you can focus your community discussions around community gun safety instead of individual rights and things, you begin to build up support for other initiatives.
Thank you. We have a question from Judy Clack. She asks, how can members of the leagues throughout the state help the League of Greater Pittsburgh to get this position adopted by consensus at the Pennsylvania League Convention in June?
Communication. The most important thing really, I think, is talking to your friends. I think most people feel right at the moment kind of helpless. They don't know what to do. And there were a lot of good things that were beginning to come out of the White House Office of Gun Violence, and that is not in operation anymore. But the philosophy of working on gun safety as a community norm, I think, is something worth talking about, and we should give people a positive thing to look forward to. So talk to people.
I think in terms of having been on the state board for conventions in the past, the practical issues are that the convention, the state board will have a program committee, and Pittsburgh will be submitting to the program committee our position and ask that it be put on the agenda. Let's assume that they endorse that and they put us on the agenda. Then every league, of course, gets delegates who go to the state convention, and the most powerful thing that a local league could do is to advise their delegates to support voting yes. They like to see the state adopted by concurrence the Pittsburgh position, because if that occurred, then all the local leagues would have a position, frankly, without having to do the work, but to put their energy into doing local projects. And those are going to vary by wherever that local league is, because your environments are different. But we talked about the one about the law, making it possible for a municipality to control its own guns. But there are lots of other things that are, when you start thinking about the public health part of it, when somebody is proposing a development, let's say, then it might be possible to build into that plan things which would make it harder to have a gun event take place there. Or if somebody is planning on clearing out abandoned housing, to put in place, you don't allow it to be abandoned, but put it into use as a community garden. A community garden becomes a place where you're not going to have people doing gun violence nearly as much as an abandoned lot. Things like that. It's where you can use the public health approach, and you're doing something else that's benefiting the community, but at the same time, you're helping to prevent a gun situation.
Okay. Roberta Winters is asking, if a local league concurs with the Pittsburgh study, will that local league adopt this policy as if it is their own?
Yes, that's really what happens. They add it to their local positions, and just there'll be two in the state instead of just one.
So you've saved us a lot of work. Okay. Are there any other questions? Okay. Well, I just want to say thank you so much, Preston and Nancy, for your research and for this excellent presentation. And I'm so grateful for your dedication to understanding and advancing the League's position on this critical topic and working to change our country's gun culture. On behalf of the League of Women Voters, hold on, I'll just share my screen. So yes, on behalf of our League of Women Voters of Bucks County, I want to thank everybody who joined us this evening, and we hope you found this presentation informative and motivational. And we hope you'll let us know what you think in the survey that you receive after the program ends. We'd really appreciate your feedback. Based on the comments in the chat, we will send a separate email with all of the links that we shared in the chat so that you could access those on your own when you want to do your own research. And I'll mention again, this program is being recorded and will be available on our Bucks County League's YouTube channel. And I hope you'll join us for some upcoming programs, especially if you're in the Bucks County area. We have an in-person program in partnership with Braver Angels on March 22nd about cell phones in schools. And we have an in-person program in partnership with the National Institute for Civil Discourse on April 5th about how to disagree better. And the QR code on the screen and the link in the chat will take you to our website for more information about these programs. And I would also like to invite you to join the League of Women Voters. We are a nonpartisan group. We are open to women and men, and we are committed to empowering voters and defending democracy. Please join us. And for now, thank you so much for being a part of this program, and I hope you have a good evening.
Okay, we did it.